Good afternoon. Welcome to the second breakout session of our day one for the 2021 PBIS National Leadership Forum. This session is on developing comprehensive, multi-tiered, school-based suicide prevention. My name is Kelly Perales. I am co-director of the Midwest PBIS Network. We're one of the regional hubs for the Center on PBIS. And joining me today are Eric Bruns and Jennifer Stuber from the University of Washington, and they'll introduce themselves here in just a little bit. We're going to wait a few minutes so that all participants can join the session live and make sure that they can both see the presentation as well as hear the audio. And so while we are waiting, we're going to just go through a few of the reminders about our conference. First of all, these are our virtual forum expectations. We encourage you to be responsible, respectful, and safe. And that includes in the overall event, as well as using chat in Pathable. And if you have any questions that you would like to have our presentation team respond to during our time here together today. Keep in mind that if you are here, you probably registered for this session and could easily find it in your agenda in the Pathable platform. You are able to go in and out of sessions and add others to your day if there's something else that you saw that you're interested in. Recordings of all the sessions are also going to be available shortly after each session ends. So you can go back and listen to any that maybe you wanted to also listen to during this time when you chose to join us for our presentation. Because you're in here, I think you also figured out how to navigate the session page. But again, big idea here is that you can interact with us by using the chat poll. Katie Pullman is our content facilitator for this session. She's going to help respond to your questions. We encourage you to put those in the poll tab. And you'll notice in the file tab that we did upload the PowerPoint for our session. So you can grab that if you want to follow along with us or go back and look at any of the slides afterwards. Again, here are some screenshots to help you think about how to use chat, as well as ask any questions that you have. You'll notice if someone puts in a question, you can click on the little like thumbs up in order to let our team know that that's a question that you also have, so that we can be sure at the end of our time to spend about 10 or 15 minutes responding to questions. You might accidentally navigate away from being able to see the live session if you click on any other aspects in the Pathable platform while we're presenting. You can easily get back to the session, but we do encourage you to just be present, use chat, put your questions in there in the poll tab, and aside from that, listen to myself as well as Eric and Jen during the presentation. If you do get stuck, you can go back to your agenda and get back into the session by clicking on the little card. And if you really need extra support, you can go to the help desk. And so at the top of your Pathable app, you'll find the little button that says help desk. Click there and you'll be able to get some additional support. All right, and so with that, I'm just going to give a time check. Okay, we're going to go ahead and get started. Again, my role here is to help situate suicide prevention, intervention, and postvention within our PBIS multi-tiered system of support. I'm going to then turn it over to Eric and Jen, who will talk with you more about the work they've been doing out in Washington and guiding us through what it looks like and sounds like to do this work. This is a really important topic for those of us in our field because suicide is the second leading cause of death among young people. And as professionals, we want to create safe, consistent, nurturing environments for social, emotional, behavioral health and wellness in all schools. And so in my role as a professional, this work has been very important to me. And I want to share with all of you that it is also personally important to me. I have 4 teenagers and young adults who are in that category where suicide is the second leading cause of death. And so as a mom, it's critically important to me that we focus on prevention, recognizing when kids have additional need, and connect them with appropriate supports. I will also tell you that in February of 2020, just before all of our worlds turned upside down, my kids lost a friend to suicide. And so as a family, this became a very important topic as we navigated how that made us feel and how we supported our friends and our community during that difficult time. And in early September, our field in education and in school mental health lost a champion. Michael Kelly, who was a professor at Loyola University, really dedicated his career to the work that we do in multi-tiered systems of support and aligning and integrating social, emotional, behavioral supports. And he died by suicide on September 2nd. And if you'd like to read more about his description of what it feels like to experience depression, we have an article that he wrote many years ago, and that might be something that's helpful to you in your own work, either as a professional or in your personal life. And so with that, I do want to give some additional expectations, especially when we're talking about sensitive topics like mental health, depression, anxiety, trauma, and especially suicide. So please take care of yourselves, recognize your own feelings, how you might be feeling not only during this presentation, but also afterwards. When talking about mental health and suicide, these are sensitive topics. And so if you need help, please reach out either through local resources or connecting with your natural supports, colleagues, family members, friends. There's also a National Suicide Prevention Lifeline and a crisis text line that we offer to you, just in terms of how this topic resonates with you in your own life. What do we mean when we're talking about mental health and wellness? This comes from work that was done first in Florida through their Project Aware, and then more recently shared in this resource here, best practices in universal social, emotional, and behavioral screening. But the idea is that we're not only talking about illness or risk factors, we're also talking about protective factors and resiliency and the ways in which we can build our own wellness competencies and strategies. And so this is a definition that's offered for you in thinking about mental health and wellness. Some data, and I know that Eric and Jen are going to talk more about some additional specific data points, but this data is really all about the kind of why we're here, talking about this topic, doing this work, and thinking about how to leverage PBIS as a multi-tiered system of support for supporting social, emotional, behavioral health and wellness. And essentially, we know that in the last 19 plus months now, there has been a growing concern around anxiety, depression, the impact of trauma. We heard about that in the keynote this morning, and how we can coalesce and come together around these data points and leverage it to impact the need for students and families. In fact, just last week, the U.S. Department of Education put out this guidance document. You heard it mentioned again during the opening today. And so I encourage all of you to check it out because it really promotes and endorses the work that we all have been doing collectively in our field and that you're going to hear about today in this session. And so PBIS, which you heard Kent mention, in its 24 years, has lots of evidence and data to suggest that it is the framework for aligning our initiatives that are around social, emotional, behavioral health and wellness, and the way in which we can situate suicide prevention and intervention into our efforts. And here's just a quick snapshot of some of that data. And again, I'm sure you've seen resources throughout the day or that connection back to pbis.org that will help you find the data and the resources that you need to leverage in order to prioritize this work in your state, district, and school. And so with that, I want to introduce Eric Bruns and Jennifer Stuber, and I know they're going to talk a little bit more about themselves and their work. I'm going to do my best to help forward their slides in a timely way. So with that, I'm going to mute, and Eric, I turn it to you.
Thank you so much, Kelly. It's a true pleasure to be here with you all and to be part of this year's virtual PBIS forum. I'm sitting here in my office, a place that I don't usually come in. So if you hear any construction noise outside, apologies for that. Haven't been here in a while, didn't realize that was going on. But along with my dear friend and close colleague, Jen Stuber, we're really excited to be able to just talk a little bit about exactly what Kelly just set the stage for, which is how not to necessarily just do our best with implementing programming that may hold promise for bolstering the emotional wellness of our students, but also prevent suicide, and do so in a way that actually aligns with what we know is so critical, which is to do this work in a comprehensive, multi-tiered fashion. Jen is the real expert on this. She's been doing this work as co-founder of Forefront Suicide Prevention. I'll introduce myself and then hand it to Jen to do the same for herself. I'm a clinical psychologist and a professor here at the University of Washington in the Department of Psychiatry, and I'm associate director of the University of Washington School Mental Health Assessment Research and Training Center. And by way of a little bit more of an introduction to the SMART Center, we are single-mindedly and extraordinarily passionate about the question of how best to support the well-being of our young people through the provision of effective multi-tiered school mental health supports. We know that schools are where are the most common place for young people to receive mental health supports. We know that schools, when they implement universal social emotional learning, have the capacity not just to improve their school climate and their students' well-being, but also academics benefit as well. So for so many different reasons, our true north is the question of how best to get what works into schools to help our young people. So that's a little bit about me and where I do my work. Jen, would you like to introduce yourself?
Sure, Eric. Thanks so much. And I hope Eric and I popcorn back and forth between each other during this presentation. So yeah, I'm Jen Stuber. And as Eric said, I'm also at the University of Washington, where I'm an associate professor. I'm actually originally trained in a weird combination of things, epidemiology and public health policy, in a school of public health, and ended up in a school of social work because I really wanted to do applied research and teaching. And here I was, moved to the West Coast from the East Coast about 10 years ago. And here I was teaching frontline social workers who were going to be in mental health settings. And my own husband started to experience severe symptoms of depression and anxiety. And as someone trained in public health in a school of social work, teaching frontline social workers, I really didn't know anything about how to support him. And sadly, my husband did die by suicide in 2011. And I do this work every day because I believe that most suicides are preventable, and it's hard work, but it first starts with having conversations like this one. Back to you, Eric.
Thanks so much, Jen. You can go to the next slide, Kelly, and thanks for advancing for us. So we're going to continue to riff on this extraordinarily important theme about doing this work within a multi-tiered system of support framework. And then I'm going to hand it back to Jen to really give some in-depth examples of how best to do school-based suicide prevention planning in a way that appreciates and is guided by a multi-tiered system of supports kind of framework, which we think is so critical, including some examples. I think you can go ahead and skip forward to learning objectives. There's another slide showing us, but you already see us, so you don't need that. So learning objectives really to gain a better understanding of the relationship between suicide prevention and MTSS, provide some examples across the tiers, as I just said. So going ahead to the next slide. So one of the things you saw in the keynote, anytime that you hear about PBIS and MTSS from Kelly already, is the importance of using data in a thoughtful way. And when we attempt to avail our local and state partners here in Washington State, where Jen and I do so much policy work as well as training and support to districts and schools, we can look to our own Healthy Youth Survey just to see, once again, another way of encapsulating the challenges that we're facing. So this was the last Healthy Youth Survey that was done before the pandemic. It's every 2 years. It was not conducted in 2020. So this is before, as someone who has clinical privileges at Seattle Children's Hospital in the outpatient psychiatry, being asked to cover in the ER, do assessments, because we are at complete capacity at all times right now. So we know that this is pre-pandemic numbers and that the challenges are only worsening. The data are truly disheartening. When I see these data, what I think about is my daughter's last outdoor socially distanced birthday party with 4 of her best friends, and knowing that by the time they get to high school, 3 out of 5 of those girls, if these trends continue, won't be able to control their worry in a way that's going to affect their schoolwork and their lives. 2 out of 5 of those girls will be depressed. And some data that's not shown here, but also from the Healthy Youth Survey, that 1 out of every 5 of our high school students are going to have had thoughts of suicide. And again, that was before the pandemic. Go ahead to the next slide. Again, we don't need to belabor the point, but I do think that it's critical for us to recognize that, again, even before the pandemic, suicide rates among our young people had risen 50% in the decade, in our previous decade. And more than that for younger kids aged 10 to 14. While our youth homicide rate tends to be trending down, our youth suicide rate continues to rise. Next slide. And for every death by suicide, there are 25 attempts by young people, and those have serious repercussions among their peer groups, all of those who are in the classroom or the school with those young people. So when it comes to the seriousness of the problem, you know, the visual here is that every event is just the tip of the iceberg that we're facing. And regardless of how you frame the work that we're trying to do with respect to school mental health, bolstering student wellness, preventing suicide, the question is, what are states, schools, and districts doing to attempt to address this issue? Not only do we want to reduce the likelihood of these tragedies striking our schools and our students, but we know that comprehensive multi-tiered programming can also bolster student wellness, school climate, and student readiness to learn. So let's put aside multitasking. I'm as guilty as anyone of that during even the most exciting and informative presentations. I would love you to use your, I think I have it open here, the Pathable chat to first start. We've got about 100 folks on. Thank you all so much for joining. Let's just do a quick poll using very kind of blunt tool here. Please just use the chat feature in Pathable to simply write in the chat, yes or no. Would you say your school or district, or whichever one you're most familiar with, has a defined approach to school-based suicide prevention? Just simply type yes or no in the Pathable chat, and let's see what kind of general ratio we have among our attendees. I think this should show up in the chat, correct, Kelly, and so forth. So,
hey, Eric, can I pop in for a second on this
sure.
slide?
Yeah.
One of the reasons I think this visual is so important is we oftentimes talk about those deaths, and it's a lot of kids in 1 year in the United States dying by suicide. And, Kelly talks about second leading cause of death. I just want to highlight it's 20% of all deaths in this age range, which is completely unique to any other age range. Like normally any cause of death, whether it's cancer or heart attack, is like 1 to 2%. To have to be 1 in 5 deaths of all young people. But the hopeful part of this diagram is that, at that waterline and below that waterline, look at how many opportunities for prevention there are. Mental health conditions are the leading risk factor for suicide. So if we can get on top of those and some of the other well-known risk factors and learn warning signs, we can really kind of head off some of those 2,156 deaths.
Right, which is another example of the way in which, as per the PBIS framework and MTSS, having access to and making use of your data is so critical. What do we know about our student population? Which kids are missing school in a way that might suggest that there's a challenge? Which are we using comprehensive screening or even risk identification methods? Jen will talk about all of these things. So one more question for the chat. So it's disheartening, but not surprising to say that, to see that most folks are saying that there is not a suicide prevention strategy, but we also do have some who say yes. And it may be a great opportunity then for those who say yes, or maybe you were thinking it was kind of a maybe. What would you say is a keyword or a phrase? I see a couple. Hope Squad is an example. What is a keyword or phrase that describes your approach? It could be a way in which you do this work, or a way of kind of describing that, or a specific program, or a set of strategies. Would love to see some examples. So we see that there's one individual who is saying that that they are the suicide screener. Behavioral health referrals come to me. So there actually is a point person in your school, in your instance. What are some other things that we want to use as examples? I'm going to take a look at the chat here real quick to see if this is useful for Jen and myself, who spend a lot of time asking, how do we take what is currently going on and in any given school or district and make it that much better. So a school social worker is at the hub of the work there. Thank you. So Tier 1 Safe Talk training for all staff members and high school students. Are you familiar with that one or similar ones, Jen?
Yep.
Maybe you could describe it while we're seeing other kinds of.
Okay, so that would fall into the category of so-called gatekeeper trainings, learning how to identify students who might be struggling and support them, and what are the resources for referral. Beautiful.
So those are the only examples I see thus far. Oh, here's one. There are mostly reactive interventions rather than preventative, i.e. there are screening processes, but nothing on the Tier 1 level. My guess is you've probably seen a lot of that, Jen.
Yeah. And then once you're screening, of course, what do you do and how do you make that a meaningful intervention with the student and their families?
A couple of very familiar programs, QPR as well as mental health first aid as options that folks are putting out there. QPR combined with universal screening. We have behavioral health social workers and universal screeners. So right, when we're talking about doing this within an MTSS context, the question will largely be around how do you make that connection between the universal screening work that you're doing and the right kind of response? And that'll be something that Jen will describe in a little bit. 3 times a year, all student universal screener for SEL. Assist for over 200 staff over the past 5 years. Are you familiar with Assist?
Yeah, I mean, these are some really impressive things some of these schools are doing. I think a key thing will be to think about how do we to make sure that we're really thinking about this comprehensively across the tiers.
So a lot of QPR and mental health first aid, working towards screening, currently doing targeted screening, which we know that there's different, screening can mean different things depending on what kind of resources and how it's gone about. So targeted screening may very well be much different than universal screening. I don't know if you have any kind of examples of how you've seen that play out in schools, Jen, that you've worked with.
Just to say that, we'll talk about this a little bit more, but, targeted screening tends to be the more popular thing to do, right? Because schools want to ensure that they have adequate resources. And so once you open up the universal screening box, you have to be really prepared to have a meaningful response.
So I think you can go ahead to the next slide there. We'll check in with the chat. Feel free to continue to put your thoughts about the effectiveness of any of the strategies you use, or things that you've found to be really successful as well, because we would love to turn back to those. I think we're already learning a little bit from each other just through the Pathable chat. So our observation is that there is a lot of school mental health and suicide prevention out there, but sometimes it is piecemeal. And so that's why we are casting this whole presentation in the context of how do we do this in an MTSS framework. And this is not just our observation as advocates. This is also the observation of our US Secretary of Education, who has said that student access to structured mental health services in schools hasn't been implemented in a functional way. It's been ancillary and after the fact. We have the opportunity now to redesign schools and make sure that mental health is a core part of the school's DNA. So you can go ahead to the next slide. And I think that the key thing here is, I know that I'm preaching to the choir for those of you who are probably at a PBIS forum, but you know, what we often see, especially right now during the kind of COVID response era, is that we are missing opportunities to build better systems in so many different ways. That oftentimes we are implementing a universal screener without that question of how does it fit within all of the strategies that we're going to use for the students that are identified. We sometimes make arrangements with community providers and make sure that they're in the building somewhere seeing kids without asking, how are they part of a systematic approach? Are they on the school team? Are they known by the school staff? Are they doing universal tier 1 and tier 2 work, or are they just seeing kids? And I worry greatly that we're missing this opportunity right now to build better systems for the future in the context of the COVID relief dollars that are flowing. So as one school principal that I was talking to said, it's like trying to save a sinking ship by throwing treasure chests of gold on board when we are providing these resources without a question of how are we going to incorporate it. And so one of the, needless to say, true pioneers of our PBIS and MTSS work, George Sagai, the way he puts it is that MTSS is something to help organize the adults and their implementation of best practices. We can even have some of these great research-based tier 1, tier 2, whatever practices. And if we're not organizing our efforts, then we're going to miss an opportunity. Go ahead to the next slide, Kelly. So when we implement school mental health or suicide prevention within a multi-tiered system, we're using an operating system to make sure all the component parts are working together. I'm not going to belabor the points here about MTSS features, but at a headline level, we do MTSS not just to see kids, but to make sure we're organizing our efforts and our resources through the convening of teams at the school level as well as the district level, asking what are we currently doing and how does it map to what we know we need to be doing? How is it part of an overall comprehensive plan? So that kids get help early and we are doing things that are likely to work. So again, this is the context setting. We want to get to the examples. So one last slide from me, and then I'm going to pass it over to Jen, just to kind of reinforce that the alignment of MTSS and suicide prevention, again, it all comes back to the same interlocking efforts that PBIS reinforces over and over again around systems, where we have a team focus and we have clear plans on how folks are going to work together at all tiers. We are emphasizing universal prevention programming and skills building, as some of you have commented in the Pathable chat that you're doing with your teachers and school staff. We incorporate student voice into the selection of these programs, into the way they work, as well as into their own pathways to receiving help. And finally, using data at the district level, at the school level, and monitoring the effectiveness of any of the programs or the strategies writ large that we do in schools and in districts. And now that's just a whole bunch of words on a slide. So I think what's most important is to now hand it over to Jen to talk a little bit about what might that look like in practice when it comes to proactive multi-tiered suicide prevention. So take it away, Jen.
Great, Kelly, would you mind switching the slide? So this is our beautiful Mount Rainier, where Eric and I have the privilege of living at most of our lives. And I put this up here for a reason. First off, I'm thinking that by the time you got to this part of the presentation, you're going like, okay, what are they talking about? Like, you know, this is heavy. This is an intense topic. You know, there's a lot of frameworks. You know, we have a lot on our plates. We have to be reactive right now, and it might feel like you're doing, you know, having to climb up a mountain as we're dealing with this topic, particularly because I'm going to pile on a little bit here and say, you know, one of the reasons that I got involved after my husband died by suicide was that I was noticing this piecemeal approach, particularly in schools. My kids are now in middle and high school, and feeling like, okay, how do we do this more comprehensively? And then, of course, getting to know Eric and his team and the folks in the MTSS and PBIS world, realizing, okay, there's a ready framework here. And if we can just take a breath and think about, okay, let's get up this mountain, but we're not reinventing this wheel. We're building on systems that we are already building for a whole other set of reasons related to children's emotional and behavioral health. And we're really just integrating suicide prevention because it's so important to also single out. And so hopefully this mountain image is really designed to see the challenge, but also see the opportunity that rests here. So next slide. So to continue with our mountain analogy, and I actually really love this analogy here. I know you all are very familiar with the triangle and the various different frameworks for MTSS and PBIS. This one is one that we came up with for suicide prevention that I think just really translates well. So this is a river bed, river stream bed. And, you know, most of our kids are upstream, right? And although increasingly, you know, we have many more kids who aren't upstream, but that upstream area, that up in that riverbed, we're really trying to put dams in place to build social emotional learning skills, mental health literacy, sources of strength, protective factors. And really, like, the objective is to keep kids from thinking about suicide to begin with. And I think we kind of like lose sight of that. Like, we're so reactive to, let's find the kids, let's screen them, let's make sure they get into help. And that's superbly important. I don't want to dismiss that, but it's really important to be thinking about what are we doing to prevent the faucet from, or keeping those kids from flowing downstream. So that's what that upstream dam represents. The midstream dam represents what can we be doing. You know, we know that there are some pretty clear risk factors that intersect with kind of school structures and school dynamics, such as bullying, you know, use of technology and media, you know, in unsafe ways. Like, there are lots of things, various racial and ethnic groups, LGBTQ plus groups, you know, who are at higher risk. So what can we be doing to really, you know, kind of build strength and connection and resilience in groups that tend to be at higher risk? So, and then also, like, what do you do when you've got kids who you're worried about? You may not be ready to, you know, call the hotline, but you're worried about. So what do you do at that midstream? So you need to create those dams. And then there's that downstream dam, which is like, you've identified kids, you're concerned, you're thinking that this might be beyond what the school itself can handle. We need to connect to community-based resources. And how do we do that? And how do we effectively do that and make sure that we've got our ducks in a row before it's a crisis? And so that's that downstream dam. And then sadly in suicide, you know, what does happen is kids do go over that waterfall, that metaphorical waterfall. And that represents kids who've attempted suicide. And then, you know, ideally, you know, there's a reentry plan to help them get back into school, and to help change the course, the trajectory that they were on. And then, of course, there are those youth that die by suicide. And for those of you on this call, and maybe that's something to pop into the chat, you know, for those of you on this call who've been through a suicide, a death in a school, you know, as Kelly brought up earlier, it's an experience like no other for a school to go through. And clearly, the more that we can do to prepare around this, what we call postvention, death after suicide, to prevent potential contagion risks amongst other students, and also to allow our students and our faculty and, you know, our staff to heal, is just vitally important. I mean, you can set a school can go so asunder, you know, after a youth suicide death. It can be a really huge challenge, and can take months, years to recover if not done well. And I know I'm probably speaking to the choir here about these things. So feel free to put in the chat. And Eric, I really have trouble multitasking between these two.
All right, I'm keeping an eye on it there.
Yeah, so keep an eye on it for me. Thank you. So this is what we're really attempting to do in this presentation. Next slide, please. Is to talk about what this really looks like. And so I've really appreciated, again, that structures, that framework for MTSS around structures, programs and practices, and then data. And so when I say structures for suicide prevention in schools, again, we're really trying to build on some of the things you probably are already building for other social and emotional behavioral health issues. So again, a team-based approach is essential. School counselors cannot be the only people who are responding and working on this issue. It really needs to be the whole school, the whole community working on it. But you've got ideally a team in a school that's really helping do the formative planning. There's some student input into what that looks like. We need to make sure we have memorandums of understanding, MOUs in place with behavioral health resources that do exist in communities, or figure out what are some virtual ones, some telehealth ones that can be used if you don't have those in your communities. One thing that I think schools often don't think about is an environmental scan of the building, the chemistry lab with chemicals, rooftops, making sure that the actual environment that your students are going to school in every day is safe from the standpoint of preventing suicide. And then, of course, another systematic thing to be thinking about are procedures in the aftermath of suicide. And there are several resources out there that talk about best practices and policies after a suicide, done by AFSP and SAMHSA. Next slide, please. Sorry, Kelly. So ideally, as I said, we are working on some of these structural issues, these systemic issues, before we start just popping in programs into classrooms or, practices into counseling. We really do want to make sure that we have those structures soundly in place. And I'd say that's really like the first start. But then, of course, we do want to start talking about programs and practices. And when I talk about practices, I'm really talking about, what's the training that we're giving our teachers? What's the training that we're giving our janitorial staff? What's the training that our principal gets? What's the training that our mental health counselors get? Which, certainly there are probably different levels to this. And it was lovely to see in that chat that we had people, it sounded like people were really looking at different levels of training. I mean, assist being the most in depth you can go around suicide prevention, but then, Safe Talk and QPR providing some really good, universal information that can be used. And so that's practices. And then programs, that is, what are we putting in front of students? And, I've really kind of struggled with this, and I'll talk more about this in a moment, but because I feel like there's some really good things out there, and clearly we're not moving the needle on this problem. And so I'm going to talk about what are some of those really good things that are out there in the realm of universal prevention programs. But I'm also going to put some challenges out there about that. And so, yeah, so at that prevention, intervention, postvention, that really to me maps on to kind of tier 1, tier 2, and tier 3, which is that triangle that you're very familiar with. And so hopefully you see the connection between the stream analogy I just showed and this multi-tiered system of support. Okay, next slide. Okay, so programs and practices, as I mentioned, I already touched on this. What are the behavioral health and suicide prevention efforts happening in your school? And again, it really needs to be not ideally, big emphasis on students, but then obviously teachers, other staff in the building, parents and caregivers are very vitally important as well. And so the other piece I want to bring up in the context of programs and practices is what we've mentioned already, which is screening, right? Which is there's different methods available, different tools available to do screening. And most schools, I would say, from what in the West anyway, really do more targeted screening. They basically use a QPR or Safe Talk strategy to identify students at risk informally, which really relies on teachers making, having eyes and ears, and which frankly the literature has shown doesn't always happen, that there's not that continuity. It's definitely not as effective as universal screening. to rely on one of those programs. But then there's targeted screening. Once you have a kid, let's ask them some questions, figure out what level of risk there is, and then figure out what we're going to do based on that. And so I would say schools are moving in the direction, like they're realizing like, oh gosh, we really have to be doing this targeted screening and intervention with those tier 2 kids, tier 3 kids. And at the same time, I think there are strategies for tier 1, but they tend to really be focused on, kind of how do we identify kids who are tier 2? They're not really focused on how do we keep kids from thinking about suicide to begin with. Next slide. Okay, so this past summer in doing a grant, we did a pretty extensive literature review. Erica, you remember that? Haha, that was fun. Extensive literature review.
Won't forget it anytime soon.
Yeah, of these school-based suicide prevention programs, and we really liked a lot of what we saw. Honestly, this isn't an opportunity for me to like diss other programs, not at all. But I really also felt that there was still some room for improvement. And so here are some of the things that we saw. So I've already said this: few of the programs that are out there really have shown any evidence that they prevent suicide ideation attempts. Not all, but there are very few. And as I said, many of the programs we're using, the so-called gatekeeper training programs, but how do you identify a student who might be struggling? They oftentimes increase knowledge and improve attitudes, but they don't necessarily result in the behavior change we're seeking, which is finding kids and supporting them and making sure they get to the next step for care. I will say this is kind of a thing of mine that I've been going on and on about lately, which is that I wonder about student engagement. If we're presenting mental health literacy curriculum in a classroom, like we do for all other subjects in health class, like that's a very common tier 1 approach, and great that that's growing, that literacy is growing. And to what extent are students really engaged in that? Where is the student voice? Where is the student direction around that? Very few of the programs we saw have been culturally adapted. Sorry, go back one second, Kelly. And then I guess I would say, where's the theory? And I mean, I'm a very applied researcher, and sometimes I go theory schmeary, but I actually really think this is important. So let's go to the next slide. So this slide basically is a slide by Rory. This is Rory O'Connor's integrated motivational volitional model of suicidal behavior. And what he talks about is that, youth, adults, whoever it is that may be, everyone in the world is basically at risk for suicide. Everybody has a different exposure and potential risk to suicide. And your stress, your psychology, your psychobiology around stress, your environment, major life events, these things all stack up. And frankly, we're all vulnerable and could be vulnerable. And I think the sooner we all kind of realize that, I think that's going to help us a lot here. But so that we get into this motivational phase, and usually there's certain types, Rory O'Connor talks about, there's certain types of events that happen in a student or an adult's life that result in defeat and humiliation. That can be quite triggering. So you might have, underlying depression, anxiety going on, or some substance use happening, which, those are things that are in that pre-motivational phase, those risk factors. But then you add some of these triggering events that result in defeat, humiliation, shame, and you have, much higher likelihood of suicide. And then you start to feel trapped and hopeless. And, mental health issues by in and of themselves, if you don't feel like you're getting better, and if you feel like you're losing out, on your profession or on your school achievement, you can start to feel trapped, right? Or like your breakups are very common instances of defeat and humiliation. And so, if you think about it from that standpoint, if we're really trying to prevent ideation and attempts, we're talking about ideations in the motivational phase, like you really have to be thinking about that suicidal process, that theory that's going on there, and then target programming that really works on that. And so that's what, I think, I'm not so sure how much a lot of these programs have really gotten that deeply into that. And then of course, the volitional phase on the right-hand side, the pink box really talks about, okay, now you have suicidal behavior, you have a suicide attempt, you might have some self-harming that has suicidal intent engaged, and again, what's happening there in that transition, and what do you do when that transition has occurred? And what kind of protective factors do you build? So I think that theoretical standpoint is just some backdrop that I really wanted people to think about before I kind of show kind of a smattering of some of the suicide prevention programs that are out there that are available at Tier 1. Kelly? Okay, so at Tier 1, what do all students need? Well, and the thing is, this doesn't all have to happen at once. You could even think about kind of like staging these kinds of things across a student's, middle and high school trajectory. But at some point, we definitely want literacy. We definitely want that, recognizing signs and what do you do? And we know that peers are much more likely to identify students students are more likely to know than teachers if their peer is thinking about suicide. And that students are much more likely to say something or do something if they've had some kind of training around this, which is great that many people are doing that with the peer focus. But you got to be careful. Like, everyone was really reluctant to kind of run out and do gatekeeper training during the pandemic to students directly, because you put that out there and then you don't have the support in place that you need. You may actually trigger a kid. Talking about suicide does not cause suicide, but you want to make sure you're in a room in an protected environment where you can protect kids when you're providing this kind of information, so that you can provide it in a safe way. Of course, social and emotional learning skills are vitally important to that, that motivational phase that I was talking about. And so can we zero in on some of those SEL skills that are going to be the most important to mitigating suicide ideation? And then, of course, I think the more that students are engaged, are really using their own experiences, empowered to feel like their life experiences matter, and what's happened to them in the past is trauma informed, right? Like, we need to be taking into consideration, what's happened to kids and how does that all interplay as we talk about mental health and suicide prevention. Next slide. Okay, so I'm just going to do some Tier 1 examples. This is like nothing extensive. I'm just going to go super quick and just see if you've all heard of these programs. And this is basically ones that I have more research evidence behind them, although someone mentioned Hope Squad earlier, and I'm pretty fairly certain that has some pretty good evidence behind it around Tier 1. But again, what's the evidence for is kind of the key question. So some examples. Next slide. So this is the literacy approach, pretty well-known curriculum out of Canada. It's got quite a bit of research behind it that, kids walk away from this mental health and high school curriculum course that is free. I love that it's open source. And they learn a lot about mental health. And again, attitudes, knowledge increases, that could be kind of foundational to a lot of really positive changes. YAM, in a multi-country randomized trial, this program not many people have heard about, but really actually probably has the strongest evidence of all of the Tier 1 so-called suicide prevention programs. And it's no secret why that is. It's very interactive. Student voice is much more present. There's a lot of discussion and role play. And so something to maybe check out. Next slide. Okay, so many of you mentioned gatekeeper training such as QPR, ASSIST, which ASSIST is really, very, very in-depth gatekeeper training. Safe talk. So training the teachers is one thing. What are you doing for the students? And so signs of suicide, not to be confused with sources of strength, is another program that's out there. And what's good about this program, and I know a lot of schools that use it, is that they really do, they integrate a good depression screen at the end. And so they are kind of combining a twofer. They're giving you a 2-for-1. They're giving you some basic information about how to support a friend and what are the resources in your school. And then they're also giving you screening right then and there. So that's something that a lot of schools have been using. And it does find kids who are struggling. Next slide.
Jen, wouldn't you say that the majority of the kind of most effective mental health literacy or classroom-based programs do have that active integration of a opportunity for students to self-refer to help, which does provide to some extent a first, one approach to trying to get that opportunity out to all students, or some degree of universality of opportunity to identify students early?
Yeah, absolutely. And I think, a lot of times what schools will do is they'll train the teachers And that happens a lot in our Washington state-based schools. They'll train the teachers and then kind of hope and pray that you're actually finding students. And I'm not saying that's bad. That's part of it. The approach truly does need to have more of a student-focused orientation. And that active ingredient you talked about, this is sources of strength, similar in some ways to Hope Squad. This one doesn't. They call themselves a suicide prevention program, but they're really focused more on social norms and building strengths and protective factors. Sources of strength and Hope Squad do have some evidence behind them that they're effective, not again in reducing suicide ideation or attempts, but in kind of strengthening some of these core fundamentals. But they're peer-based, which is great. So more student-directed, more student voice. And at the same time, which peers are getting it, which peers aren't. It's difficult to think about the universality of this, and has to be very carefully implemented. Next slide. All right, so we covered kind of the just very, very cursory literature review around tier 1 strategies. And I have to say, I am excited that there's stuff out there. At tier 2, we're really talking about individual interventions and coping strategies. And so individual interventions, that's where, you found your kid who may be at risk. What do you do? Are you doing screening or a more in-depth risk assessment to determine risk level? Are you doing so-called safety planning, which I'll talk about what that is in a minute? Are you reaching out to parents? When are you activating community-based supports? How are you supporting families? All of these things. So we really do need procedures around that. And then of course, there's also examples of, okay, as I said before, there may be kids, I know a lot of mental health school counselors, or a lot of school counselors now are being asked to do groups. Well, some of these coping skills groups, using an evidence-based curriculum might be a strategy there for that. So that's what I mean at tier 2 around suicide prevention. Next slide, Kelly. So here's going to give you a real world example from a school district that I'm pretty on fire about. It's Battleground School District. And if you want to find out more about them, come to me because they're currently pretty overwhelmed. But if you go to the next slide, so Battleground School District, the reason why I'm kind of on fire about them in a good way is that before we really started doing a lot of work on the suicide prevention front in Washington State, this school district, through its Project Aware grant, really got some really cool tier 2 programming up and off the ground. So basically at the district level, they determined that all the staff across all of the buildings, there wasn't universal screening, there wasn't even universal suicide prevention programming like we talked about, but they had a very, very solid and clear procedure around what they were going to do when kids are identified at risk. And they were not having trouble finding kids who are at risk, sadly. I'm sure most of you who aren't doing universal screening are still finding a lot of kids and getting a lot of kids referred to your counseling staff. So they have a checklist, which is very clear to help them make decisions about what they're going to do next. And so if you go to the next slide, Kelly. So that's just an example of this risk assessment checklist. Keep going. It just goes into depth. Safety plan. Okay, so safety planning, put in the chat box, maybe, have you heard about safety planning? Yes or no?
That'd be great for folks. If you've heard of it, let us know. If you're doing it in a systematic way, definitely add that into your chat response.
Yeah. Well, so safety planning is a very common, well-known intervention strategy that is used in healthcare settings around suicide. Emergency departments, for example, will sometimes do safety planning, primary care settings, et cetera. And so more and more schools are taking safety planning into their realm. Basically, what this tool is and there are apps for it on phones and whatnot, which is kind of nice, but basically helps students recognize that their suicide crisis is time limited. And there is something that got them there. And there's a set of things that are happening. Maybe they've experienced this more than once that, have really caused them to kind of peak in their suicide crisis. And so it's really helping them first realize that they've been here before and they didn't die, right? And so how do we build more coping strategies in with that recognition that it doesn't have to be this way? And it's not something you can do overnight, but there are things that you can do to distract. There are, coping strategies that you can build. There are people you can go to see, and we have to make sure that's very much directed by their sources of people they trust, right? And so this is very much it's a gift to students if you do it well. It's really their plan. It's not the counselor's plan. It's definitely not the parents' plan. It's their plan around how they're going to stay safe when they start to have thoughts about suicide. And so it's honestly, it's often not done well. And then that kind of defeats the purpose of doing it at all. But it is a next step that a lot of schools are increasingly taking. And I'm very sure that in the literature in the next few years, we're going to see several studies showing the effectiveness or not of using safety planning in the school-based setting. Next slide. This thing is a little laggy. Oh, notification of emergency. So how are you notifying parents? That's Battleground School District does that kind of universally. They've got clear policies around that, and they provided the next slide, Kelly. They provide an information sheet, which is vitally important. Like, you should definitely never be sending a kid home who you're concerned about suicide risk without a conversation with the parents about, what are the signs, what should they be looking for, where can they take their kid, and then very critically, what methods do you have around your house that your kid could use to end their lives? Like, very important conversation that schools really do need to integrate into this suicide prevention space. Eric, did I get any feedback there on safety planning, by the way?
There was a good 20 or so folks who say they're doing safety planning. Some are saying they're just starting. Some are saying that they are aligning it with risk assessments as one of the strategies that, needless to say, would make sense to pair together.
Yeah, got it. Okay, cool. And then next slide.
Jen, I'm kind of curious about the reducing access to lethal means in that battleground parent note. Is that something that schools ever do kind of universally, as opposed to for students who are identified as being potentially at risk?
That's a great question, Eric. Ideally, it should be done universally, as well as when students are at risk. And what I mean by that is, if you're offering parent training, caregiver training around suicide prevention, make sure that it covers this. Conversations about firearms, medication storage, safe medication and firearm storage. And I'm currently developing a new curriculum called Asking is Caring that basically guides parents and caregivers through questions that would sometimes be awkward. Like, people don't necessarily want to go talk to their friends, when their kids going over for a sleepover about whether they own firearms. But like, we have to do that in the same way we're checking out, making sure they're home for the night, there's going to be parents around, or that the media is not going to be on all night long. We should be checking on some of these other things as well. Okay, that, I think, again, good point. And then this is my dear friends, Jim and Liz Mazza, developed DBT Skills in schools. This is a very extensive curriculum, in many ways very impressive. I also have my own opinions that it could be a very important resource to be offering at tier 2, because it's many sessions and would definitely take a long time to integrate at a tier 1 level. And Jim and Liz's book and their skills are amazing. They work. We know that. And in terms of like, DBT has the most research evidence-based suicide prevention therapy set of skills building that there is. However, in that school's context, it's a heavy lift. So tier 1, if you can do it, they intend it for tier 1, but I think it could also be integrated at tier 2. Next slide.
And okay, that's a group-based program, correct, Jen?
Yes, yeah, it's intended, and they've developed it to be, teacher implemented, and so, but I think oftentimes counselors are the ones who end up doing it in schools. Okay, so I've just basically given you a whirlwind tour of tier 1 and tier 2 programming and ideas. And now let's talk about tier 3. And so that's those kids who've gone over the waterfall. What are we doing? And this is stuff that, like, honestly should be happening like right now, like if you don't have this in place, because you don't need to wait to start thinking about policies around reentry and postvention. Because if you don't have them, that's going to be a big struggle when these things inevitably will happen. So in terms of tier 3, it's really about establishing relationships with community-based resources, identifying policies for managing students at risk, establishing procedures for safety plans, reentry procedures, postvention procedures. And you notice I'm talking about safety planning in tier 2 and in tier 3, because safety planning is an ongoing process. It's not like a one and done thing. It should ideally be used as the student's tool over time. Okay, next slide. Some examples of tier 3. Tier 3. So first off, I'm very excited to know that we're likely to see more mobile crisis response teams in communities in the next decade than we've ever seen before. I won't go into the complex policy reasons around that, but if you are a community that has access to a children's mobile crisis team, what a great idea to build that bridge really firmly between that team and your school, so that when you've got a kid, it's Friday afternoon at 4 o'clock and you're trying to get home and you're trying to end the week here, and you're really worried about a kid and you can't get a hold of the parents, you have a go-to resource to help with this transportation. You can't get a hold of parents, etc. And so building that resource, and frankly advocating for that resource, is a key thing I think folks can start to be thinking about. Next slide. I just pulled this up. I was pretty impressed when I found this. Basically, we all complain about because there aren't enough community-based mental health providers. They're so scarce. It's so hard in our community. I hear that over and over again. And so this Charlie Health, and this is not an endorsement, it's just something to check out. This is telehealth on steroids for, and they claim to have, all their therapists and mental health providers, taking different kinds of insurance, no insurance, as well as, really having skills in suicide prevention. So something to check out, if like a telehealth version of these kinds of services that are so scarce in communities. Next slide.
I would say that another benefit of telehealth is often in our rural communities where there's very few providers. Not only do you have increase the likelihood that you'd be able to access somebody, but that person is going to be anonymous. They're not going to be someone that the family knows, that the kid knows, that you're going to see in the grocery store. And what we hear a lot from adolescents in particular is that when they live in those kinds of communities, they would prefer to talk to someone who's not from the community so that they can feel like it's truly confidential.
Yeah. And so I'm going to speed up here just so we have a little bit of time for questions, but what is your school doing in terms of reentry procedures for students who have attempted suicide? This is vitally important. So these kind of bullets here, what staff member is responsible for handling that? Is there a reentry meeting that is set consistently? What accommodations are made, if the student is struggling? Are those issues that have maybe helped bring them to this place being addressed? And what does that really look like? It's, we're used to doing these kind of documented plans. Doing this around reentry is no different. Next slide. This is just a checklist that's currently available out there that kind of goes through this in more detail around reentry. Next slide. Okay, postvention. This again is a place where you really want to have a very detailed, thought through plan, because you don't want to be in the situation where you have a student or frankly a teacher die by suicide and then not have a plan for what to do about it, or a principal. That's actually happened in Washington State. And so here you go. You really need to be thinking about this. Like, what's your infrastructure around it? What are you doing right in the immediate aftermath, the next day, post-crisis, around anniversaries and memorials? I mean, this is vitally important, not just because, the whole school climate, really is going to depend on how you do around this major event, but also because there are documented contagion effects that can occur in communities from a student dying by suicide when students know each other. And this is also something to be concerned about when there's a high-profile suicide in the news, which we know that there are contagion effects from that. Next slide. And then I just want to bring it all full circle with the MTSS piece. Is like, we've talked about systems, we've talked about programs and practices, and in terms of data, really as much as possible, kind of driving your programming based on that data that you have in your building. And then, take the time to evaluate your tier 1 programming, take the time to look at how are those tier 2 and tier 3 processes working, take the time to look at, after school suicide happened or a reentry plan was put into place, how did that go? Like really take that time. And I know it seems, again, like I'm putting that Mount Rainier up in front of your face again, but what I'm really trying to say here is that once you start doing this, it will get easier. The more that you can put these processes and systems in place, it actually will get easier and make your life easier overall, and not always be reacting to fires.
Jen, I know that in your comprehensive multi-tiered suicide prevention work, you all have promoted the use of kind of a school level checklist that aligns with the tiers and the programming and the points here about how can you be proactive about assessing where you're at now and use it to fill gaps. Is that something that's available or that you might suggest, or that we can
if people want, I'm going to put my
files?
contact information at the end. I'm happy to send it to people. We're in the process of revising it. Right now, it's developed around prevention, intervention, and reentry and postvention, and I want to make sure it's also aligned with MTSS. So we're doing a little bit of revision around it, but I definitely think it's a helpful resource that I'm happy to people who want it. So my email will show up on the last slide here. And then, is that all we've got in terms of slides?
I think so. There's one last point to make for everybody. I think.
Take this. Yeah, take this, Eric.
I was just going to say, I mean, that was a whirlwind hour, and we have some time for questions. I don't know if there are any or not. Maybe I'm not able to see them, so I'll defer to Kelly to let us know. But feel free to put anything specific into the chat or the polls, however it works. But if there was something that we were trying to leave you with, in addition to some of the examples that Jen gave about specific strategies across the tiers, is to ask this question of your school or district. Do you have a suicide prevention planning approach? And is it indeed something that aligns with the principles and kind of core features of MTSS? You just heard that if you look at our omnipresent triangles in school mental health and MTSS, there are many examples. Sometimes they're interchangeable. Sometimes there's kind of a Venn diagram of similarities across the tier 1 literacy programs or the approaches to doing screening or risk assessment. Lots of examples, but the main thing is using the kind of keywords or the kind of points that Jen just made. Do you have approaches that go across that entire riverbed, or if you prefer, and or the pyramid of programming that MTSS provides? Jen, what is it that you want to make about the question of whether strategies are school or student centered or adult or student directed? How would you make that point?
Well, I mean, honestly, I've been doing this work around comprehensive multi-tiered suicide prevention for nearly a decade, trying to provide consultation to schools and districts. And I really started to feel like the programming was really about making sure the school felt good about what they were doing. And I started to feel like there wasn't enough emphasis on what is really happening for those kids, like what's their experience, what are we doing for them further upstream. And so just to leave you with that, I think there's work in the field of suicide prevention. There's innovation to be had. Students can play a huge role in helping shape these next steps. I don't think we've figured out this problem. Let's put it that way. Clearly we have not. And so, but I think it's just something to think about. Like, I think, at that tier 1, when I said there's many different things to be thinking about, those gatekeeper skills, literacy, student voice, like I think you have to be thinking about it. You have to be thinking about ultimately what is the student experience.
So Jen, there is a question here that should be straight to an area that you've got intimate knowledge about, which is examples of what you mean about community children's mobile crisis response. And this individual is asking if this is like C-CORS in King County or something different.
Oh, so you're familiar with C-CORS. So the CORS program in King County, that's exactly what I'm talking about. It's basically, instead of calling 911 to have the police come and transport your kid to an emergency room, we need something different. And not, that's on the horizon, that we're going to start seeing a different response than that, because there's a national movement happening around this. But these youth mobile crisis teams are a really key thing, and they're not the same as just a regular mobile crisis team. Like, you really do want providers in there with specialized skills around youth. And these are popping up in more and more communities. And so if your community doesn't have one, it might be time to talk to your legislators about getting one.
Yeah, if there's an example about just how critical the system overlay is, what could be more a more fundamental or foundational example than whether or not tax dollars of whatever type are adequately going to an adequate response to crisis that can be accessed through something like the 988 crisis or suicide prevention line.
Great. And then last slide kind of gives you some information about how you can get a hold of us. And I'm actually kind of formally affiliated with SMART now. So, send everything to Eric, and then he'll, just kidding. You can send it to me at jstuber@uw.edu if you have any questions or want any additional resources. So thank you so much. You have been an awesome audience. I'm sorry I can't see you though and be there in person, but you've been a great audience, and I hope you're doing this work and taking care of yourself while you're doing it. And there's a mountain to climb, and it's one that's achievable, but it's going to take time and teamwork.
Kelly, are we missing any other questions out there?
Not that I can see, no.
Oh, here we go. Jen, you mentioned safety plans may not be done well. What tips or best practices do you have related to that?
Oh, great question. So typically, sometimes what happens with the safety plan is it's like the person, the counselor or the clinician is like, pulls out this piece of paper and they just kind of start scribbling some notes, asking some questions of the student. And it's not really an active ingredient. Like the safety plan, like that whole conversation I was having about helping that young person understand that suicide isn't inevitable and that they've had these crises before and that they've waxed and waned, kind of like the risk curve. There's actually a picture, if you look up, there's a distinction between safety planning and safety planning intervention. And people in the field of suicide prevention often don't even understand like that there's a distinction. And the distinction is safety planning intervention has that active ingredient around really taking apart that suicide risk curve and helping the youth to understand like what did their last crisis look like? What were the signs that things were getting really dark and heavy? And then, how can we utilize the skills that we have, the resources that we have, so that when we get in that place the next time. And it's completely fundamentally driven by the student. And it's something that you ideally revisit. So, and refine over time.
Is that something that will raise the bar of the type of person who can be trained to do safety planning, or the amount of intensity of support that's needed to be able to do it well?
There are not good studies out there. A lot of schools are doing it because frankly, they're like, what else are we going to do? Like we have to do something. And this is something that's been used in so many clinical settings and has strong evidence. But I think it's the kind of thing that I'm fairly certain that, peers can be trained on. And so then by extension, other types of counseling staff and not just, the select few. But, you do need, somebody who's kind of in charge of it. So at Battleground, where they do safety planning, the woman who was leading the effort, she was trained in doing it well. And she followed up and monitored the safety plans as they came in and actually like kind of hit it home over and over again. Like this is not just filling out a paper, filling out a form and checking a box. This is really about helping this youth understand that this is their plan, it's something that they have ownership of. And really kind of emphasize that active ingredient. So getting somebody in the district kind of really comfortable with that is, I think, a key piece.
And one of our participants made a note that it was going to prompted me to ask something I was going to anyway. That your suicide prevention event in fall 2019 did an amazing safety planning training. Is there a way to access safety planning trainings?
Yes. So Forefront Suicide Prevention, which is the organization I co-founded, no longer the director of, but there you can, if you go to in the forefront, we can put that in the chat, in theforefront.org, you can request a 3-hour safety planning intervention training that I would say is better than anything else that's out there with the school's audience. I helped to develop it. I was pretty excited about it. It's taught by school counselors with a lot of experience.
Putting that into the chat. And I think we may be out of time. Any housekeeping to do before we end?
No.
No. Okay. Well, thanks to everyone for joining us today. It's always raises our game to have to try to organize these kinds of materials to present to the field. So it's been a pleasure. Thank you.
Thanks.